If you're over 60 and dealing with persistent bad breath, I need you to listen carefully because this could be your body sending you a critical warning signal about something much more serious than just what you had for lunch. Recent medical research shows that nearly 40% of adults over 60 who experience chronic bad breath actually have an underlying health condition that requires immediate attention. And many of these conditions can be life-threatening if left untreated. What's even more alarming is that most people dismiss bad breath as just a normal part of aging, when in reality it could be signaling diabetes complications, heart disease, kidney problems, or even certain cancers. The most important tip that could potentially save your life is coming at the end of this video, so please don't click away. Here's what most people never realize about bad breath after 60. Your mouth is like a window into your overall health, and as we age, our bodies become less efficient at masking serious internal problems. That persistent metallic taste or constant bad breath that mouthwash can't fix isn't just embarrassing. It's often your body's way of crying out for help. The good news is that once you understand what your breath is trying to tell you, you can take action to address not just the symptom, but the underlying cause that could be silently damaging your health. I want you to do something right now that will help me give you even more personalized advice. Write your age in the comments below and tell me how long you've been dealing with bad breath. I personally read and respond to every single comment because your health journey matters to me, and I want to make sure you get the guidance you need. Let me walk you through the 7 most serious health conditions that commonly cause bad breath in people over 60, starting with one that affects millions of older adults, but often goes undiagnosed for years. Uncontrolled diabetes is one of the most dangerous causes of bad breath in older adults, and here's why this should terrify you if you're ignoring the warning signs. When your blood sugar levels remain consistently high, your body starts breaking down fat for energy instead of glucose, producing chemicals called ketones that create a distinctive fruity or acetone-like smell on your breath. This condition, called diabetic ketoacidosis, can lead to coma or death if not treated immediately. The scary part is that many people over 60 develop type 2 diabetes gradually, and bad breath might be one of the first noticeable symptoms. If your breath has a sweet, fruity smell that doesn't go away with brushing or mouthwash, you need to check your blood sugar immediately. Here's what you can do right now. Keep a simple breath diary for 1 week, noting when the smell is strongest and what you've eaten. If the fruity smell persists regardless of food, contact your doctor for a glucose test. In the meantime, increase your water intake to at least 8 glasses daily and eliminate sugary drinks completely, as dehydration makes diabetic breath even worse. Kidney disease is another silent killer that announces itself through your breath, and most people over 60 have no idea their kidneys are failing until it's almost too late. When your kidneys can't filter waste properly, toxins build up in your blood and get expelled through your lungs, creating a distinctive ammonia or urine-like smell on your breath. This is called uremic breath, and it's a sign that your kidney function has declined significantly. What makes this especially dangerous for people over 60 is that kidney disease often develops alongside other conditions like diabetes and high blood pressure, creating a perfect storm of health problems. The terrifying reality is that you can lose up to 90% of your kidney function before experiencing obvious symptoms, but bad breath often appears much earlier. If your breath smells like ammonia or has a fishy odor, especially in the morning, this could indicate your kidneys are struggling. Here's your action plan. Start monitoring your blood pressure daily if you're not already, because high blood pressure is both a cause and consequence of kidney disease. Reduce your sodium intake to less than 2,000 milligrams per day by avoiding processed foods and restaurant meals. Most importantly, ask your doctor for a simple blood test called a comprehensive metabolic panel, which can detect kidney problems years before you'd notice other symptoms. Liver disease is particularly sneaky in people over 60 because it often develops slowly over decades. But when your breath starts smelling sweet and musty, like rotting fruit, your liver may be in serious trouble. This distinctive breath odor, called foetor hepaticus, occurs when your liver can't properly process toxins anymore, allowing them to build up in your blood and escape through your lungs. The most frightening aspect of liver-related bad breath is that by the time you notice it, your liver function may already be severely compromised. People over 60 are especially vulnerable because years of medication use, alcohol consumption, or even common pain relievers like acetaminophen can gradually damage liver cells. If you notice a sweet, musty breath odor combined with fatigue or yellowing of your eyes, this is a medical emergency. Your immediate action should be to eliminate all alcohol and unnecessary medications, but only after consulting with your doctor about safe alternatives. Start supporting your liver by drinking green tea daily, which contains compounds that help protect liver cells from damage. Add cruciferous vegetables like broccoli and Brussels sprouts to your meals at least 3 times per week, as these contain natural compounds that help your liver detoxify more effectively. Heart disease reveals itself through bad breath in a way that shocks most people, because we don't typically connect our mouth to our heart health. However, the same bacteria that cause gum disease and persistent bad breath can enter your bloodstream and travel directly to your heart, causing dangerous inflammation in your arteries and heart valves. Studies show that people with severe gum disease are nearly twice as likely to suffer from heart disease, and this risk increases dramatically after age 60, when our immune systems become less effective at fighting bacterial infections. The bacteria responsible for that chronic bad breath can literally eat away at your gums, creating open wounds that allow harmful microorganisms to flood into your bloodstream. Once these bacteria reach your heart, they can cause a life-threatening condition called bacterial endocarditis, where the inner lining of your heart becomes infected and inflamed. If your bad breath is accompanied by bleeding gums, loose teeth, or a persistent metallic taste, you're looking at a potential cardiovascular emergency waiting to happen. Here's what you must do immediately. Upgrade your oral hygiene routine by brushing for a full 2 minutes twice daily with a soft-bristled toothbrush, and start flossing every single day, even if your gums bleed at first. Rinse with an antimicrobial mouthwash that contains cetylpyridinium chloride, which is specifically effective against the bacteria that cause both gum disease and heart problems. Schedule a professional dental cleaning every 3 months instead of the standard 6 months, because aggressive plaque removal is crucial for protecting your heart. Lung infections and respiratory diseases create some of the most persistent and concerning types of bad breath in older adults. And what makes this particularly dangerous is that many people dismiss chronic cough and bad breath as just getting older. When you have a lung infection, bacteria multiply in your respiratory system, producing sulfur compounds that create a distinctive rotten egg smell on your breath. Chronic obstructive pulmonary disease, which affects millions of people over 60, creates the perfect environment for harmful bacteria to thrive in your lungs and airways. The terrifying reality is that these bacterial infections can spread to other parts of your body, causing sepsis, which kills more than 250,000 Americans every year. If your bad breath smells like rotten eggs or sulfur, especially if you're also experiencing shortness of breath, chronic cough, or chest tightness, your lungs may be harboring a serious infection. Your immediate priority should be to stop any smoking or exposure to secondhand smoke, as this dramatically worsens bacterial growth in your lungs. Start doing deep breathing exercises for 10 minutes every morning, inhaling slowly through your nose and exhaling through pursed lips, which helps clear mucus and bacteria from your airways. Consider adding a humidifier to your bedroom, as dry air makes it harder for your respiratory system to clear out harmful bacteria naturally. Gastroesophageal reflux disease becomes much more common and dangerous after 60, and the bad breath it causes is actually a warning sign that stomach acid is damaging your esophagus and potentially increasing your cancer risk. When stomach acid repeatedly washes up into your esophagus and mouth, it creates a sour, acidic breath odor that many people try to mask with mints or gum, not realizing they're ignoring a serious medical condition. The real danger is that chronic acid reflux can cause Barrett's esophagus, a precancerous condition that dramatically increases your risk of esophageal cancer. People over 60 are particularly vulnerable because the muscle that keeps stomach acid in your stomach naturally weakens with age, and many common medications can make reflux worse. If your bad breath has a sour, acidic smell that's worse after meals or when lying down, and you experience heartburn or regurgitation, you're dealing with more than just bad breath. Start sleeping with your head elevated at least 6 inches, using a wedge pillow or raising the head of your bed, because gravity helps keep stomach acid where it belongs. Stop eating at least 3 hours before bedtime, and avoid trigger foods like coffee, chocolate, spicy foods, and citrus fruits. Most importantly, don't ignore persistent heartburn or acid reflux, because early treatment can prevent serious complications, including cancer. Medication side effects cause bad breath in ways that most people over 60 never connect. And this is particularly dangerous because the medications that save your life might be creating other serious health problems. Many common medications prescribed to older adults, including blood pressure medications, antidepressants, and antihistamines, can cause severe dry mouth, which allows harmful bacteria to multiply rapidly in your mouth. When your saliva production decreases, you lose your body's natural defense against the bacteria that cause both bad breath and serious infections. The frightening reality is that some people take 10 or more medications daily, creating a perfect storm of side effects that can lead to dangerous oral infections, difficulty swallowing, and even aspiration pneumonia. If you're taking multiple medications and experiencing persistent bad breath, along with dry mouth, you may be at risk for serious complications that could land you in the hospital. Review all your medications with your doctor or pharmacist to identify which ones might be causing dry mouth, and ask about alternatives that have fewer oral side effects. Start using a saliva substitute or dry mouth spray throughout the day, especially before meals, to help maintain the protective moisture your mouth needs. Chew sugar-free gum containing xylitol after meals, as this natural sweetener actually helps fight harmful bacteria while stimulating saliva production. Now let me remind you why understanding these connections between bad breath and serious health conditions is so crucial for your well-being and longevity. Bad breath after 60 is rarely just about oral hygiene or the foods you eat. It's often your body's early warning system alerting you to potentially life-threatening conditions that require immediate medical attention. The myth that bad breath is just a normal part of aging has prevented countless people from getting the treatment they desperately need for diabetes, kidney disease, heart problems, and other serious conditions. Your body is incredibly intelligent and constantly communicating with you through symptoms like bad breath, but only if you know how to listen and respond appropriately. The encouraging news is that your body has an amazing capacity to heal and recover, even after 60, when you give it the right support and treatment. Even small changes in your daily routine, like improving your oral hygiene, staying properly hydrated, and paying attention to medication side effects, can make a dramatic difference in both your breath and your overall health. You're not alone in this journey, and recognizing these warning signs early puts you in control of your health destiny rather than being a victim of undiagnosed conditions. Remember to like this video if it opened your eyes to the serious health connections behind bad breath, and subscribe with notifications turned on so you never miss important health information that could save your life. Share this video with friends and family members over 60 who need to understand these critical warning signs, because early detection and treatment can mean the difference between a minor health adjustment and a life-threatening medical emergency. Leave a comment below telling me which of these 7 conditions surprised you the most and what other health topics you'd like me to cover, because your questions help me create content that truly serves your needs.